Medicine.
Hello everyone. Today I would like to talk about diabetes, the most challenging problem of our times. What is diabetes? Diabetes is a disease in which the glucose metabolism of the body is deranged due to absolute lack or relative lack of insulin. Insulin is a hormone which is produced by the pancreas in our body and it controls the glucose metabolism. What is this glucose? Whatever the food we are eating is divided into three types like carbohydrates, proteins and fats. The carbohydrates, when they are digested, become glucose and they give energy to the cell with the help of insulin. Like that, the deficiency of insulin, either partial or absolute, will cause the disease called diabetes, and because of this the glucose in the body or in the blood is increased and various problems are taking place. Diabetes is an epidemic because according to the International Diabetic Federation, now there are 36 crores of diabetics in the world, and in India there are nearly 6.5 crores. Out of the 130 crores of population, we are having nearly 6.5 to 7 crores of people are diabetics, and many are having pre-diabetes, which is a condition which comes before pre-diabetes. So what is the difficulty of diabetes? The burden of diabetes is in its complications. The burden is due to microvascular or macrovascular complications, disease of the small blood vessels or disease of the large blood vessels. Like that, when you are not controlling your diabetes, in the long run you can have disease of the small blood vessels like retinopathy, that is the disease of the eyes, which can cause blindness, and coronary artery disease, which can cause heart attacks, and peripheral neuropathy, which can cause numbness in the feet and disease of the feet, and also disease of the brain, which are strokes, paralytic strokes, and etc. like this. So you can also have recurrent infections because of the high blood sugar, which enables you to get infections more easily, and the body resistance is dropped and immunity is low. So the importance of treating diabetes is to control its complications like retinopathy, like cardiovascular, cerebrovascular, and foot diseases, infections, etc. In addition to this, diabetes can also cause problems during pregnancy, problems during surgery, and problems during any other infections in the hospital. So what we have to do is, everybody who is above 35 years with a family history of diabetes in the parents must check for his blood sugar. Also, those who have had recurrent infections and ulcers which are very much chronic, and those who are having hypertension and heart disease, those who are having overweight, and those who are having sedentary, all must be able to control their blood sugar. So the normal pattern of blood sugar will be, the fasting blood sugar must be 100 to 110. The post-lunch or 2-hour glucose, 75 gram glucose test should be more than 200. If it is 100 and 140, you are not diabetic. If the values are more, you have to consult a doctor and stop treatment.